I have a long history of injury. I initially got injured as a child, about 12 years old, got bucked off a horse, which gave me a lot of neck, back, and hip problems. And my hips are the really, really big issue. And I suffer a lot of pain from them. And so my friend said to me, you know what, you really should go see Dr. Carlson. I really think he could help you. 6 weeks ago, I couldn't sleep on my left side, particularly, and the right side was almost as bad. And now, 6-7 weeks later, I am sleeping quite often on my side. And he keeps working on it, and it gets better and better all the time.
I love helping people without drugs. It's easy. You know, there's all kinds of people who can be better with more motion and a bit of rest, exercise, good nutrition, tiny bit of manipulation, better posture, and they can go off maybe 30% of their medication, you know? Everybody's on medication for this and that. So medications are of course important, but you want to try to stay off them as long as you can in your life. You don't want to go to the doctor and get on more and more. My goal is, you know, not to try to get you to come back as much as possible, but to try to keep you well and keep you highly functional, so each motion and every part of your spine actually moves separately. And if everything moves separately, then you're going to have proper function.
I would recommend Dr. Carlson to anybody. What he did for me was fantastic. I had a back injury a couple of months ago, and I could barely walk. And I phoned Dr. Carlson on a Monday morning. He got me in right away. And like I say, I was basically crawling in here, and I walked out of here standing up. And for the next 3 days, he worked on me. And at the end of the week, I was walking and standing up straight. And now I come every 4 to 5 weeks to get maintained, and he keeps my body straight. And due to basically from 30 years of playing rugby, I've abused my body, and he fixes it up.
I would say right now it's about 4 years I have seen Dr. Carlson. I have a big problem with my neck and shoulders and lower back as well. I was usually every day pretty sore, and to come and see Dr. Carlson, even sometimes just one treatment did the job for me.
To me, I think Dr. Carlson takes more of a holistic look. He's not just looking at, let's put your bones in place. He looks at tissue and sometimes does some special massage in certain areas, which really relieves a lot of my pain. And I just find that the holistic approach, looking at the bigger picture of what it is that might be causing it, seems to be targeting my problems way better.
The main thing is that patients are relaxed when they come in, and hopefully they can relax and enjoy the whole experience as much as they can. But we have, of course, our water massage table, which is a nice way to begin the treatment. So basically patients go on there for 5 or 10 minutes, relax deep, then they come in here. If they have a muscle spasm, do a little tiny bit of soft tissue work. If they don't, then we do some kind of light adjusting, or just, you know, whatever they need to take, light to medium adjusting to basically get the job done. I do have an impulse, which I use once in a while. Another technique we incorporate is Graston technique, and these are used by some of the best sports chiropractors and sports physios in the world. And I went, when I was living in Scotland, flew all the way to Chicago. I was the first person in Europe to actually go do this technique. And anyway, I flew over because my hands were actually hurting me like crazy, because I was the only chiropractor in a town of 100,000 people, right? And so my hands were aching every night. So I went over, got this tool, and I simply basically learned that by using this tool, 2 or 3 treatments, my hand pain just disappeared. So basically breaking down the fascia, allowing the circulation to go back and forth in that hand, and then my hand got the motion. I was actually getting arthritis in this finger and there, but within I was having this night pain, but within a couple treatments, it was gone. We try to tailor each treatment is definitely for every patient. Every patient's different, so you can't have the same treatment for every patient. Some people might get a bit of soft tissue work, some people might get the activator or the impulsor, some people might just get the spinal adjusting, or some get a range of everything. I have to try to, you know, treat everyone like they're my family. And if they want to accept that fully, it means embracing more of a full life, basically more full motion, more responsibility for your posture. You have to help me. It's not just me, it's you.